Hey YouTube, welcome back to my channel. My name is Dr. Daniel Kaplan, and my mission is to make psychology accessible to all. In the previous video, we talked all about the sexual response cycle, and I mentioned that there are some disorders that occur on the three first phases. So as it relates to desire, excitement, and orgasm. In today's video, we're going to learn all about disorders of desire. And there are two primary disorders we're going to learn about. We're going to learn about their diagnostic features. We're going to learn about some of the causes or sources of origin. And then we're going to talk about some treatments for these disorders. So if you like what you have to hear, give me a big thumbs up, click the subscribe button, click the notifications tab, and that will allow me to bring this video to a larger audience. So without further ado, let's talk about disorders of sexual desire. All right, so I mentioned that there are two major disorders of desire. There is the hypoactive sexual desire disorder, and then there is the female sexual interest or arousal disorder. Now, desire is the first phase of the sexual experience, and it includes our urge to have sex, it includes sexual fantasies, it includes attractions to others. So what does a hypoactive sexual desire disorder look like? So at a minimum, we're tracking this condition for 6 months, and the person has to report having either few to no sexual thoughts, fantasies, or desires, and it has to cause some level of distress for this person. As it relates to the female sexual interest and arousal disorder, once again, 6 months. So these are chronic conditions, and the person similarly has reduced sexual interest, reduced arousal, and at least 3 of the following features where there is either a reduction or absence of, whether it be sexual interest, thoughts or fantasies, sexual initiation or receptiveness, reduction in excitement or pleasure during sex, responsiveness to sexual cues, and response to genital or non-genital sensations during sex. Now, these features, similar to the hypoactive sexual desire disorder mentioned above, has to cause some level of distress. So if we were to put it all together, we would say the hypoactive sexual desire disorder is characterized by a lack or little interest in sexual activity, even though the physiological responses are normal. Even though the physical responses are okay, the person is not initiating. So there's nothing problematic with the plumbing, so to speak. It's just more of a psychological issue. So with female sexual interest or arousal, we talk about also there's a lack of interest, the lack of initiation, and little excitement during the sexual experience, right? So that's, if I were to glean back what the previous slide we were talking about, this is kind of in a nutshell. So what influences one's sex drive? Well, the reality is there are several factors that influence a person's sex drive. They include biological, psychological, and sociocultural factors. And each of these can have an influence on one's sexual desire and play a role in the reduction of one's sexual desire. Now, if we were to categorize, well, what's the common case? The most common case of low sexual desire or even a sexual aversion is caused by sociocultural and psychological factors. However, that does not mean biological factors can't impact. So let's go through it. What are some of the biological causes for disorders of desire? Well, the first thing is there are hormones involved with desire. So if there is a disruptance in hormones like prolactin, testosterone, estrogen. These hormones can impact one's sexual desire. Now, other biochemistry, we see the neurotransmitters of serotonin and dopamine are linked to sexual desire disorders, and some other medications, pills, and drugs. So things like birth control pills can impact one's interest or desire, psychotropic drugs, illegal drugs, things like that can really impact one's desire. And then, of course, chronic illness, because there might be some physical problem and there's some shame involved there. Now, the psychological and the sociocultural factors I said were far more common in trying to understand reasons for disorders of desire. So we see the people who have anxiety, depression, or anger, experiencing those emotional states, that can impact one's sexual desire, and it reduces it in both males and females. Other past experiences or memories around sex can contribute, especially asexual trauma, right? These factors can play a role. And then other conditions, psychological disorders like OCD. So if a person has, some kind of obsession around germs and cleanliness, that could interfere with one's sexual desire. Now, sociocultural factors, again, the attitudes we have towards sex and sexuality are impacted by the societies we live in. So there is a social context. So if there are some social pressures that can tax a person emotionally, that could impact desire as well. Things like divorce or death or job stress, relationship difficulties, all of these experiences could impact one's desire. Now, there are different cultural standards for the development of these disorders. So for males, it's harder to acknowledge the development of one of these disorders. Also, culturally, there are different mindset as to what the purpose of sex is. So, there are different reasons why people have sex, right? From a very religious or spiritual reason, the primary reason for having sex is procreation. But that isn't the only reason for having sex, right? There's a, pleasure component. And then there is a bonding with our romantic partner component. So these are other factors related to sex that, depending on one's religion or cultural value system, they may be minimized. So if the mindset is that having sex is only for religious or spiritual purposes, and you are not to derive personal pleasure, in theory, then if that's the case, there's going to be a reduction in desire. And then, as I mentioned, any form of sexual trauma could produce this disorder. So those are the two disorders, the symptoms of the disorders, some of the causes of the disorders. Now let's talk about some treatment, because I don't want to leave you with the problem without solutions. So there are 5 techniques that I'm going to introduce. One is affectual awareness. So trying to get the client to visualize their sexual experience, to be able to tap into whether or not they have any anxiety or vulnerability, or whether there is some negative self-talk about their performance going on. So that's affectual awareness, right? It's an imagery technique. We also have self-instruction training. So here is where we take some of these negative statements that a person has, and we flip those negative self-statements into coping statements. So let's say a person feels that they're not able to enjoy sex because they might lose control or someone might victimize them, right? So a coping statement for self-instruction might sound like this: I can enjoy sex, and it does not mean I will lose control. So having to tell oneself that, so that intentional self-talk, that mind talk, is going to be useful. We also have behavioral techniques. Behavioral is about what you do or actions. So these are where we get a person to engage in an action that might help increase desire. So keeping a sex diary is useful, that they can record their thoughts and feelings, because we can discuss that further in therapy to help unlock some of that. Other things that might increase sexual desire is reading books or erotic novels, books about sex, or watching erotic films. These can certainly increase desire for some. And then asking people to intentionally voluntarily, pardon me, fantasize about sex, right? So these techniques, I know it's hard to believe that you would go to a therapist and they would tell you, I want you to fantasize about sex. I want you to watch an erotic film. But if the issue is desire, and you're upset or bothered by the fact that you lack desire, or you might even have a more extreme case of an aversion where you're repulsed by the idea of sex, some of these techniques could be quite useful. Now, we also have insight-oriented activities where we either talk about past sexual experience and reflect on, hey, how might this have contributed to your current condition? And then last but not least, for the biological piece, we mentioned that hormones are part of the picture. So hormone treatments could increase desire. And the common case that I think of is a person who might have had a surgical procedure that impacts their hormone levels, such as the removal of one's ovaries. That might require a person to take a hormone treatment if they're going to maintain their sexual desire. So those are your two primary disorders related to desire. I've given you the features of each of these two conditions. I talked to you about some of the origins of these disorders, and I offered you several treatments. So once again, if you found this video useful, please hit the like button, please subscribe, click the notifications tab. YouTube counts these things. They count it more than I do, but they count it to determine the usefulness of a video. So they have their algorithm. And if you found it useful, I need you to do that so that they can push it further. In addition, if you could put a comment below, if you have questions that you want me to answer, if you had a reaction to the video that you wanted me to dialogue with you, please do, because I view this as my opportunity to increase awareness about psychology and create a learning community, which I hope you will be part of. So until next time, that is disorders of desire. Keep an eye out for my next video. We're going to talk about excitement or arousal, and we'll continue on this journey about the sexual response curve and the disorders. Take care, everybody.